PRP stands for platelet-rich plasma, wherein a patient's blood is taken and an appropriate amount drawn, and if required, an anticoagulant is also used, and this is spun for a few minutes. What this does, it differentiates the blood into different levels with the red cells, the white cells, and the plasma forming separate layers. The plasma is then withdrawn into a syringe, and this plasma is supposed to be rich in growth factors, which has shown benefits in lots of degenerative conditions, especially with musculoskeletal conditions. The use of PRP has increased significantly over the last few years, and if you were to do an online search, it's shown to be used for anything from musculoskeletal degeneration, where it first started, to hair loss, facial treatment, and all variety of other conditions. They may or may not have shown adequate efficacy or effectiveness with this treatment. I will just focus my queries on the use of PRP injection in musculoskeletal conditions. Preparation of PRP is usually a simple process. Each company has its own kit, but essentially what we do is draw about 10 to 30 milliliters of patient's blood, depending on the amount of PRP that is required. In the case here, we are doing for shoulder, and hence we draw about 15 milliliters of patient's blood. Sometimes you add a little bit of anticoagulant if there's delay between the sample done and injection. Once this has been drawn, then the sample is placed in a centrifuge machine, and according to the guidance, this is then spun for a few minutes according to the company's protocol. At the end of the time, the syringe is carefully lifted, and in this case it's a simple process of separating the plasma, wherein the internal syringe plunges in, as you can see, giving the plasma separation. Sometimes there is a little bit of blood, but as long as it's not contaminated significantly, should not matter a lot. And the plasma syringe is carefully removed, and this can then be injected into the patient. This is the plasma that we've got, which is about 4 to 5 milliliters, spun from 15 milliliters of patient's blood. I'm now going to inject this patient's shoulder, so aseptic prep has been done, antiseptic applied, and then I'm using an ultrasound machine to locate the long head of biceps here, as can be seen on the top right hand picture. The needle coming in, and then under ultrasound guidance I inject around the bicep sheath about 2 milliliters, and the rest is injected into the subacromial space. difference between a steroid and PRP injection is that a steroid is an artificial anti-inflammatory agent which reduces the inflammation but may also mask some of the symptoms, whereas the PRP is supposed to be helpful with regeneration of the degenerate tendon or the cartilage or any tissues. Also, this is not synthetic and it's patient's own tissue, so less likely to have any side effects. Also, as the PRP is patient's own blood and works differently, it takes longer than the steroid injection to show effects. So typically a steroid injection would show benefit within the first 48 to 72 hours. The PRP injection takes about 2 weeks or up to 4 weeks often to show any changes in the symptoms. And it also has a cumulative effect, as in a second injection at about 6 to 8 weeks is worth considering. The side effects of a PRP injection is like with any other injection, localized flare-up and some worsening of the symptoms can cause local inflammation, and also infection can be introduced as this is an external injection. Serious side effects are rare following PRP injection as it's patient's own blood cells and the plasma, so less likely to have any severe side effects. It may not improve the symptoms